Hello, everyone. As you're coming in, good morning, afternoon, depending on where you are, and welcome to the fourth session in the five that we're going to do on self-employment with Ray Sabula, Deborah Wagner, and Aleda Taruno. Um, I know you've heard it before if you've been here for the last three times, but I have to read the disclaimer. So the contents of this webinar were developed under Grant H421F240198 from the U.S. Department of Education. The department does not mandate or prescribe practices, models, or other activities described or discussed in this document. The contents of this webinar may contain examples of, adaptations of, and links to resources created and maintained by another public or private organization. The department does not control or guarantee the accuracy, relevance, timeliness, or completeness of this outside information. The content of this webinar does not necessarily represent the policy of the department. This publication is not intended to represent the views or policy or to be endorsed by any views expressed or materials provided by any federal agency.
All right. So welcome back to those who are back. This is session 4, and we're going to talk about healthcare benefits and self-employment. Such an important topic. We were just having a conversation about that. So we're really excited to be here and to present on this topic. If you are joining us for the first time, we are the Work Incentive Support Center, and we provide training, credentialing, and support to practitioners in the field of work incentive planning. We are housed at the Yang Tan Institute, or also known as YTI, and we're part of Cornell University's ILR school. This is our team here. I'm Aleda Taruno. I'm here with Ray Sabula today, and we are excited to be here today. This disclaimer was already read to you, but just a special thank you to NDI for their leadership managing this grant. All right, so what are we going to talk about today? Again, very exciting topic. We're going to talk about healthcare, and we're going to talk about Medicare and this really special rule called the extended period of Medicare coverage, also known as an EPMC. And then we'll switch gears. I'll provide you an overview of Medicaid, and then we'll talk about 1619B, Medicaid, and Ray will introduce you to the Medicaid buy-in for workers with disabilities. He'll touch on Medicaid expansion, and we'll talk about the Affordable Care Act, or the ACA marketplace. All right. Again, the question and answer box is open. Don't put them in the chat. Put them in the question and answer. Try to keep your questions short if possible. It's hard to go through a lot of questions when they're really long, and make sure they're complete so we know which question you are asking, okay? All right, so let's go ahead and get started. All right, let's talk about Medicare and the extended period of Medicare coverage, the EPMC. So for folks who are on Title II, they get Medicare coverage. And benefits for Medicare start 24 months after they become eligible for monthly Title II payments. So that means there is a waiting period for Medicaid coverage when someone becomes eligible for Title II benefits. During that period of time, there's a couple of things that can be happening. The person either is uninsured, they may be eligible for Medicaid, or they may be covered by their employer health insurance that they previously have that they now have to pay for. Now, there is some exceptions to this waiting period. They do not have to wait for 24 months if they have either ALS, also known as Lou Gehrig's disease, or if they have end-stage renal disease. And, the rationale is that these disabilities really require treatment as soon as possible. I think there's probably more that can fit into this criteria. Now, a lot of folks, when they go to work, they do worry that they will lose Medicare coverage if they become self-employed. A lot of people have said when we've talked to them, look, I'm okay losing my cash benefits, but I gotta have that health care, right? All right, so some straightforward rules. If the Title II benefit continues, if this person is going to continue to receive Title II benefits, then Medicare continues. When self-employment is not at that SGA level, then benefits and Medicare continue. And this can happen until this person turns age 65, when the individual qualifies for Medicare based on age. Many of us who are contributing to the Social Security Medicare Fund become eligible for Medicare at age 65 due to our age, right? Not all of us tapped into it, right? Ray waited, just tapped into it recently. But again, the Medicare can continue for this worker until age 65, which they will keep as a person who is aged, not disabled. All right. Now, what is the extended period of Medicare coverage? So if Title II benefits stop because this person is working at that less SGA level work, Medicare is going to continue for at least, and I'm emphasizing at least 93 months after that 9th trial work period month. And the reason it's at least is because some people can actually get more than 93 months of coverage. And this will depend on when they first work above the SGA level, right? So for folks who are in this category, how can they figure out when that Medicare coverage through EPMC ends? Well, there's two things you can do. You can call and talk to Social Security. I chuckle. Or there's something called the Medicare Wizard. It's something that the YTI team maintains. It's located at medicarewizard.org on the website. And you could input some information in there to figure out EPMC coverage and when that ends. Now, what happens after the EPMC ends? Workers can still keep Medicare, but there might be more costs. They have to pay for that Part A premium, which previously they weren't paying for. They have to pay for the Part B premium, which they may or may not have been paying for, and Part D, okay? Now, these costs can be really expensive, but Medicaid might be able to help with these Medicare costs. And this includes the Medicare savings programs. Each state has its rules about these, so there'll be some research that needs to be done on how to help pay for Part A, Part B, and Part D. All right. All right, we're transitioning now to talk about Medicaid. And I'm going to go ahead and give you an overview of Medicaid and start us on 1619D Medicaid. So Medicaid is a cooperative federal state program. It's authorized by Title 19 of the Social Security Act. And in just a minute, I'll show you the differences between Medicare versus Medicaid. Now, Medicaid has different names in different states. We have a lot of audience here from all over the state. And so if you're in California, they call it Medi-Cal. I think that's a little confusing. If you're in Tennessee, they call it TennCare, which I think is a little bit better. I like that name. But each state has many different Medicaid programs, and they generally are going to fall into two general categories. There's a Medicaid for low-income families and children, and there's Medicaid for people with disability and older adults. But even within these two general categories, there are other categories that may be dependent on income levels, right? So there could be a lot of different Medicaid programs. So each state is different. They may have hundreds. All right. Now, let's look at generally the difference between Medicare versus Medicaid. So Medicare is a federal insurance program. You're not going to see very many state-to-state variations. If you move from New York to California, you're not going to see a whole lot of changes in the services that are provided. However, there may be different providers for that services that you may not find in one state or the other. And Medicare is 100% federally funded, right? Along with the beneficiary premiums. I mentioned those premiums, Part A, B, and D, and that's how it's partially funded along with the federal funding that we pay into, right? Now, Medicaid is publicly funded health insurance. That means it's paid for through taxes. And federal governments set the parameters for their program, but states have significant flexibility with benefits, what services they provide, and the eligibility criteria, who is eligible for Medicaid. Now, funding is federal and state. And so there is a federal portion that comes to the states, and the states supplement their program. So funding is divided between the federal government and states, with the federal government covering from 55% in many states to 80% in poor states. Last time I did some research, the two states with the highest assistance from the federal government were New Mexico and Kentucky. All right. So let's talk about folks that are eligible for both Medicare and Medicaid, and that is completely possible. Some individuals receive both Medicare and Medicaid. These individuals, we often refer to them as dual eligible. Medicare is the primary payer of services, and Medicaid pays the secondary. So if Medicare is covering 80%, Medicaid makes up the remainder of that 20%. Now, dual eligible individuals generally will have comprehensive coverage for both health and long-term care services, and they're going to pay very little for that coverage because they have 100% coverage when they have both Medicare and Medicaid. Ray often says that they've won the lottery in healthcare because they're able to tap into both and have very little monthly costs or any costs at all for their healthcare coverage. Medicaid can help pay for Medicare cost-sharing expenses as well. All right, so let's talk about SSI Medicaid eligibility. So in most states, in the majority of states, people on SSI get Medicaid automatically. They qualify for at least $1 of SSI. They'll automatically qualify for Medicaid. That seems very easy, right? A really easy process. Now, there are some people who used to get SSI, who get SSI and continue to qualify for automatic Medicaid, even if they lose their SSI. So let me give you an example of someone who qualifies for childhood disability benefits. They're eligible for SSI, but they have a parent who retires, and now they're eligible for CDB benefits under that Title II program, right? Now, that CDB may be so high that they are no longer eligible for SSI. However, there is a special provision that allows them to continue on SSI despite those CDB benefits. So there are special provisions like that to look out for. Now, in the minority of states, SSI recipients must apply for Medicaid separately. So they have to meet their state's income and resource threshold for that Medicaid program. And of course, a lot of people on SSI worry about what will happen to their SSI if they earn enough to receive their SSI payment, right? Well, they're worried about their health care, right? Because if they know that they're on SSI and it goes to zero, what will happen to that Medicaid? So let's talk about 1619B, okay? If you're not familiar with 1619B, it's a pretty incredible program. So it provides continued Medicaid coverage to folks who are self-employed, who would still be eligible for an SSI payment if they were not working, okay? In order to qualify, the net earnings from self-employment must be below a statewide threshold, okay? And so the threshold for each state is different. And these thresholds are published by Social Security. Each state's threshold represents the average per capita cost of a person on Medicaid. For example, in Arizona, you can qualify if your net earnings are less than $59,000. In California, the threshold's about $66,000. And in Washington State, it's a little over $73,000. Okay. So even though these folks have zero SSI payment, 1619B allows them to maintain Medicaid so long as their earnings are above the thresholds for the state. Now, there is something called an individualized threshold. So if a person has more than the average healthcare costs, they can ask for an individualized threshold. And it's possible that folks may not meet that average, right? They may have more costs than the average person. Because of their disability, they require more treatment, more doctors, more services, and they can show that through an individualized threshold. It's a process that a person can go through to qualify for an individualized threshold with Social Security. All right, do we have any questions to address before we move on to the Medicaid buy-in for workers with disabilities, Ray?
Just wiping my forehead from typing. Why did the threshold decrease this year?
Every state is different. So it's possible that the average per capita cost of a person on Medicaid in that state changed. And that may be a reason why that number changed.
Yeah, but part of that equation is the average cost of Medicaid expenditures to people with disabilities living in the community. That can go up and down every year. So there are times we do see really large fluctuations in that threshold, but it is up to every state to figure that out. Okay, does 1619B help with any protections for the Medicare savings programs?
The Medicare savings programs have their own income and resource limit. So you'll have to check with your state what that is. And MSP covers Medicare premiums and co-share or co-payments. So you'll have to check out the MSPs for your state.
Okay. This is almost like me asking you for advice, Elena. A person retires, gets SSDI after 70 and Medicare. Then they go back to work. Due to age, does the person become ineligible for Medicare? I'm
No,
not sure.
It's based on age. So the person's 70,
Yeah.
they're receiving Medicare based on age. They keep Medicare.
Yeah, I'm not sure how somebody at 70 is getting SSDI. Yeah, unless they're working and that SSDI has been in place for a while. But once they retire, that SSDI is no longer payable. It is retirement benefits. They should be about close to the same, very much close to the same amount of money. All right, Crystal, I don't remember what I said to you. So if you want contact information, please give me a bit of description than that. I've been typing and typing and typing. Title II converts at FRA, correct?
Yeah. So someone on disability Title II benefits at their full retirement age does convert to retirement benefits. But there is a way for that not to happen, and that's a whole other training. All right. I can go ahead and answer the rest if you'd like,
Yeah.
Ray, if you
Okay.
want to get started.
I think that's the case. Yeah,
Okay.
my eyes are getting blurry, and I'm not sure which lens to look through at this point. And where are my slides? That's it. Move you over here. And I'm at the buy-in, correct? Where are you, Medicaid buy-in? Getting closer. Every time I learn how to do this is one more click. All right, so we're going to switch gears and talk about the Medicaid buy-in for workers with disabilities. This is a fabulous program. It was allowed under expansion by the Ticket to Work Act. That was in 1999. I'm from the state of Massachusetts originally, we have had a buy-in for over 40 years in Massachusetts, and it was a waiver program that the state got. Just the basic notion that if somebody needs health care or needs Medicaid specifically, and they are working, they should be able to purchase that. Most of the premiums are on either a state set amount. New York sets it at $25 a month. They can't collect it because it costs more than it would be worth to develop the computer system to collect it. So it's basically free. Massachusetts, lots of other states do an income-based system. There may be a cap. Yeah, I think, correct me if I'm wrong later, but California's buy-in has no income limit. You can just pay for it.
Correct.
Okay. Thank you. I should know better than to interrupt her after what I just went through. All right. The buy-in for disabled workers, 46 states offer this. Yeah, for disabled workers. Notice it's disabled workers. It doesn't necessarily say SSDI or SSI recipients. So we're looking at a program that could be eligible for anybody who has a verifiable disability. Ohio, for instance, it's available to anybody. If you're working enough to meet the state guidelines, earning enough to meet the state requirements, and you have a disability verified by a physician. It's a fabulous program. The worker must meet SSD, the Social Security definition of disability, except for the limit on SGA level work. This is talking about our folks. Our people should all be on SSI or SSDI when they first come to us. And if they meet that definition of disability, they're good to go. The worker does not have to be getting a benefit to qualify. We just talked about that. Opening this program to so many people who just fall short of meeting the SSA standard for disability. It covers workers with much higher income levels. I remember when I saw the first Massachusetts buy-in 45 years ago, the top income level was $100,000. That income level is gone now. It's like California. Your premiums may go up a little if you make more than $100,000, but you can still participate in the program. The worker may pay a small premium. During the pandemic, we had many, many states who put a moratorium on collecting the premiums. People were all of a sudden not working. You could not work, right? In many cases, they stopped collecting the premiums so that people could still maintain their health coverage during the pandemic. There are a few states out there that never started collecting the premiums again. So check your state Medicaid rules for requirements on reporting self-employment earnings. We have 57 Medicaid programs in the United States. That includes the territories. And we've got a bunch of them with Medicaid buy-ins. And if you've seen one Medicaid program, you've seen one Medicaid program. Now, Medicaid expansion, the Affordable Care Act, the ACA, the Marketplace, whatever you call it, allowed states to expand Medicaid coverage to cover more low-income individuals and families, regardless of disability status. So this is going to work for just about everybody. Medicaid expansion is available in many states. If your state now has a marketplace, you're set. The current administration has put a moratorium on any further expansion, so we really don't have to worry about new states coming on board with this. From 2013 to 2022, Medicaid coverage increased by 2.5 million people for small business employees and 1.3 million people for self-employed workers. That's a good thing. Somebody asked a question when I was doing the answering those questions about what the work requirements are going to do to this. I don't know. People are going to have to meet those work requirements. The last date to implement or things have to be put in place by January 1st of 2027. And people are going to have to be working, whatever that means in your state. It could mean education, could mean training. It's certainly going to mean self-employment for 80 hours a month. If your client, your self-employed person, is getting prepared to open up a business or has opened up a business and they're working 80 hours a month, they're all set. They're all set. And I think in most instances, particularly if it's a solo business, people are going to be working that much. It may require an increase, but we need to then pay attention to that when our client comes in and says, I'm only putting in 60 hours a month now. It might be a requirement to keep Medicaid to up that to 80. It's a pretty harsh standard. So what are community and home-based services? These are the waivers. Home and community-based Medicaid waivers provide extra supports to live independently in the community, such as attendant care services, private duty nursing, and help with household chores. These supports can help self-employed workers live independently while they're working. Many of these waivers in general provide very much needed support to individuals so that they can work. They may not be able to work if they lose their waivers. And a waiver is something akin to veterans benefits. If you ask a veteran what his disability rating is, they're going to say 50%, 80%. They know that. If you ask somebody what waivers they're on, they will be able to tell you. That's how important these waivers are. They may not know what Social Security benefit they get, but what they do. They may not know what Social Security benefit they get, but they will know what Medicaid waivers are involved. Now, let me talk to you about a few of them. I don't want you to leave empty-handed here. There was one a long time ago. The girl's name was Katie Beckett. I believe she lived in New York. And she was a very severely disabled child. Her parents both worked, so they were losing their Medicaid benefits. They were losing Katie's Medicare coverage based on the parents' income. What was the option for Katie at that point? She needed almost 24-hour care, but they were only getting 8 hours. So they had a nurse, they had mom, then they had dad. No respite for the parents whatsoever because they were providing care and then working. So what Katie's option was, and what the state told her, was we'll institutionalize Katie. And we all know what happens when you do that, particularly to a kid. Katie was very ill, but living happily at home. There was a waiver that was filed in New York for that type of disability or the severity of the disability in kids. And the state was allowed by CMS, the Centers for Medicare and Medicaid Services, to not count the parents' income and resources. Katie stayed home, got more nursing services, at the very least, so mom and dad could go out to the movies and have dinner once in a while. But the parents were able to continue work. Katie Beckett stayed home. Those kids are staying home. That's a national waiver that's in effect right now. I'm trying to think what the other one was. Way back in my history, in the mid 80s, Massachusetts applied for an HIV waiver. It was getting to the point where people were dying. If you were tested positive, you were dying, you were in the hospital, you were costing a lot to the state. Yeah. And the waiver said that if we provide medication outside of the Medicaid guidelines to anyone who tests positive, we're going to allow them to live in the community longer, to work longer, and not be hospitalized for long periods of time. And that waiver was approved, and that's pretty much gone national as well. So those are the couple of the waivers. Imagine somebody who right now is working. They've got themselves self-employed and they contract HIV. That means all of the business income is going to go towards medicine. You know that. We all know that. But with the waiver, Medicaid can kick in and provide that self-employed person with HIV meds so that they can continue. Now, the Affordable Care Act. Don't everybody scream. Because I know it's really expensive now. It's gone through the roof, but it's there. Yeah, and we need to consider everything. Yeah, and we may find out that some of our self-employed people might be able to afford care under that. Now, excuse me, the Affordable Care Act made a change for self-employed workers because they're no longer limited in access to affordable health care. Yeah, you can get it now. That's the good thing about it. I'm not going to say the price is good. In 2011, approximately 30% of self-employed workers had no coverage. By 2022, 3.3 million small business owners and self-employed workers got health insurance through the marketplace. Yeah, that is an amazing thing. By 2022, only 17.9% of self-employed workers were insured. Still, there's stuff available. Now, we know what happened. In 2025, Congress eliminated the premium tax credits so that you sort of broke even or close to even. Yeah. And many self-employed workers will pay more for that coverage beginning in 2026. Now, we have a donut shop here in Santa Fe, and they started making pizzas. They make fabulous pizzas on sourdough crust. And I was talking to the owner, and he told me that his premium went from $900 a month to $2,700 a month. And he was in a situation where he had himself, his spouse, 2 kids. He was going to have to get insurance, but the only insurance he could afford were things for desperate situations. Like I can go to the emergency room because I cut off a finger. I mean, it was that serious. It was emergency care only, although they used a different word. Fortunately, the state of New Mexico stepped in, and began paying the difference between what people were paying in 2025 to avoid the increased cost of 2026. So things turned out all right. But we are looking at some of these ACA plans that are going to cost people thousands of dollars every month. Making it an option in our situation only for successful businesses. A startup may not be likely to afford these costs, but it's still there. And the fact of the matter is, it's still there, and we can still hope there will be changes brought about to improve the situation. The loss of that tax credit was amazingly devastating to people who needed ACA for their health care. Individual coverage under the marketplace. Self-employed people with no employees can use the market or your state marketplace to find affordable health coverage through private insurance companies. Yeah, so these are all the regular insurance companies that we all know and love or hate. Yeah, and it is expensive. I mean, I don't know, what would happen. There are only two of us in this household. I don't know what would happen if we all of a sudden had to meet our own healthcare costs. I know my dogs cost me $500 a month nowadays to have insurance, although their insurance is much better than mine. Small business coverage. If the small business has at least one employee who is not the owner, spouse, or family member, it can use the shop marketplace for small businesses to find affordable coverage for the owner and the employees. I mean, that didn't work for my pizza shop. He and his spouse and his kids worked. They don't meet that definition, of at least one employee who's not an owner or family member. All right, so in summary, we're getting to the summary already. Do we have any questions before we summarize? We got through that all too fast. You ready to open up some of those questions, Aleda?
All the questions have been answered. I'm in the middle of answering one more.
Oh, all right. Well, that's good. Keep your questions coming. We will have time to finish them up. So I didn't expect this is a live TV. The first run through is always live TV, and this is what happens. Maintaining health coverage can be very important for self-employed workers. Clearly, we know that because our self-employed workers have disability. Medicare coverage continues as long as the worker continues to get a Title II payment. If Title II cash is coming through because your worker has not hit that SGA level or they're in their trial work period, don't worry about it. If the cash comes, Medicare is there. Even if a worker earns enough that the Title II payment stops, that extended period of Medicare coverage provides continued Medicare for at least 24 months. Oh, the EPMC. Okay. No, that's 93 months after the trial work period. We got to fix that slide. At least 93 months. That's a good thing. When we talk about at least 93 months after the TWP, that's our general advice. If people need to know what might happen to them 7 years and 9 months into the future, use the wizard and you can tell them that if nothing changes in your life or situation for the next 7 years and 9 months, this is the date it will end. But there's too much life there to get that specific. Okay. Self-employed workers can use 1619B and Medicaid buy-in to keep Medicaid coverage while earning more. Check if you Google SSA POMS 1619B thresholds, you'll find a list for every state. What is the threshold in your state? So you'll have some general information about that. Some of them are way up there in outer space. Some of them are a little close to the atmosphere. 1619B is just one of those programs that not only changed the lives of our clients, but changed my career. When 1619B became permanent in 1987, I stopped helping people get onto benefits. I didn't need to anymore. All of my clients got benefits and they were still living in poverty. So what I decided to do as a good legal services attorney was to help them get off of benefits and get out of poverty. 1619B can make that happen. And the marketplace, offers health care coverage for self-employed workers and small business owners. Lots of pots to stick our fingers in. Only one of them that might be very, very expensive. But hopefully we don't get there real quick and don't get there until our consumers' businesses can afford that. All right, there's our contact information. You want to share any questions now, Elena?
Okay. Yeah, so there are some good questions here. Yeah, a lot of this can feel overwhelming if you're not familiar with these rules and you're
Absolutely.
hearing them for the first time. They can absolutely be overwhelming. So the only advice I can give you is find someone who knows benefits and is a benefits planner, either through as a work incentive planner or under the WIPA programs. There are experts in the community trained to know this information. A lot of staff know the transition points. There are a lot of states who miss 1619B, right? So someone who is on SSI, they're working and earning too much for SSI and they should be transitioned into 1619B. Sometimes that transition doesn't happen. States make mistakes, things happen. And that's why it's always good to work with someone in advance of working to know what should be happening, because you may actually find that your state isn't doing the right thing. You might find a systemic issue where the state is not communicating with the Social Security program and transitioning that person into that 1619B status.
If you are having an issue with your own situation in Medicaid or Medicare, you could contact your local legal services office. They've shrunk a lot since I was part of that crew, but healthcare is one of the things that they still watch out for. And they may very well hold open houses or town hall meetings to teach people about Medicaid. But yeah, this is still overwhelming to me. It's just amazing how many options there are and all of the rules. I was talking with Aleda just before this presentation, trying to find 1619B information for somebody in Georgia yesterday. And let me tell you, doing the research to find the state rules for 1619B or the Medicaid buy-in, I think the buy-in is what I was looking for actually, can be so frustrating because they either, three things. They're either making it very confusing, they're either hiding it somehow, or it's right in front of you. But let me tell you, not many states are out there right in front of you. So even doing the research for this stuff can drive you crazy.
So someone is making the point that the Medicaid buy-in is a little bit confusing because when you think of the buy-in, the states use that, well, the BPQI, which is a verification document that Social Security uses the buy-in to mean that someone is paying that Part B premium.
Right.
And yes, that is a good point. Somebody is paying for that Part B premium. We don't know who, because that verification document doesn't tell you. So if you are a benefits planner counting on that verification, that BPQI document isn't the end all. You've got to do your research with your state and verify with your client. Are they on a Medicare savings program? Are they on Medicaid? In many states, if someone qualifies for Medicaid, the state will pay their Part B premium. But unless you dig deeper, you're not going to be able to know how that Part B premium is being paid. So yes, I understand it. It can be confusing, but again, that verification document doesn't tell you everything that you need to know.
Yep. It doesn't the BPQI doesn't even have any reference to Part D on it. And we all know that if somebody's getting Medicaid, they've automatically been enrolled in Part D. And it's just something else we need to verify, not with Social Security, but with the Medicaid or Medicare agencies.
Yes.
But
Now,
this
someone is
buy-in,
asking, oh, sorry, go ahead.
this
Go ahead.
buy-in that we were talking about today is a completely different program that's not noted on the BPQI at all.
So people are asking a tax question that I wouldn't want to give you the answer to because I'm not a tax expert. So, folks may need to consult with a tax expert to determine what are considered business expenses and if whether paying for healthcare coverage as part of expense that can be deducted for purposes of self-employment? That is a good question. I'm not a tax expert, so I don't want to pretend I am.
I ain't saying anything either. That is definitely the notion of the team that we need to put together for our people who want to be self-employed. And that team member includes a tax person. They're going to have to file income taxes. Every year. They're not like the regular income taxes we file as individuals. And that tax person needs to be in place long before that business opens up.
So the other question we have is for 1619B, we mentioned that there is a threshold. Each state has their own threshold, and that's because it represents the average cost per person, the Medicaid per person in that state. So if the person has high costs for healthcare, they would request an individualized threshold with Social Security. So the person is asking, who do they talk to about this? It's Social Security that they would talk to about their individualized threshold. The policies that are published by Social Security that are followed in the office, there is actually a specific policy for 1619B, an individualized threshold. And it actually has like a calculation sheet, for lack of a better word.
Remember when I said that last part of the calculation scheme depends upon your state's average expenditure for Medicaid for people who are living in the community? If you look at an individualized threshold, they're calling and saying, okay, what did you spend on ALEDA last year rather than the average? And if her expenses are higher than the average, her threshold will be higher. You got to look at people who have personal care attendants, who have lots of durable medical equipment. Those people are going to be the most likely candidates for individualized thresholds.
So there's a very specific Ohio question, and unfortunately, when it comes to the Medicaid buy-in for workers with disability, we don't know off the top of our heads each individual state's program. So, I'm not going to be able to answer anything specific to Ohio. If Deborah was here, she might know the answer.
She might, yeah. Yeah. We'll just put that into the pot. So if Deborah can't answer that, you'll get it through the frequently asked questions mailing.
Okay. So do you have to apply for SSI or SSDI to see a benefits planner? So there are work incentives planners in the community, and they are usually out, they work for an agency or they're independent. And so each one has their criteria for who they serve. So I can't tell you, which agency serves what. So I was part of the WIPA program, so I can tell you for work incentive planning and those who get that, the work incentives planning and assistance grant from Social Security, they do work with folks who are job ready or have a job offer. So they may not be able to help someone who's not in that situation, but they may have other funding to provide that service. So you have to check with your local WIPA or your local WIP to see what the criteria is to get some work incentives planning. I don't know if every state has a state health insurance benefits advisor, but I think it would be great if there were more people at the state level who we could go to for questions, because they're the ones that implement the programs at the local level. So if the local people are making mistakes, the state should know about it.
I think most private insurance companies have those people, and often they call themselves navigators. So I think if you were to go into your state Medicaid's manual, you wouldn't have to do much. Just get to the Medicaid manual and search the word using the word navigator. You might find that real quick. Or it might even be on their homepage.
Ray, do you know what question this is about, the 80 hours per month requirement? I'm not sure if I
Oh, yeah,
understand the question.
let me see. I thought the 80 hours per month requirement was for people who do not have a disability. Is this wrong? Well,
Oh, I see
uh,
what they're asking.
yeah, yeah, if you have SSI, you're exempt. Yeah. It doesn't say that about SSDI. Yeah. It also calls everybody else medically frail. Now, if you can define that as everybody who has a disability, good for you. I can't. So I do not know what disability standards are going to be used by the states. I'm pretty sure all the states will exempt SSI recipients, but as far as everybody else, they may need to go through a disability determination to see if they meet the state standard.
Yeah. CMS just issued guidance, and so we're looking through them and trying to figure out a lot of these pieces right now. So there'll be more information to come, I'm sure. But yeah. Okay, so again, I don't know anything specifically for Ohio.
Yeah, I
I don't
know
know if
that
that was
that
a question or a
situation.
statement.
I can't speak for Ohio either, but I know in New
Oh,
York, we have done things like that. We have just said we don't want 1619B now. We want to use the buy-in, because somebody needs to save some money to buy a new car. The resource levels are so much higher in the buy-in. You can turn your back on 1619B and move into the buy-in.
yeah. So again, in terms of buying coverage for a business and whether the business is buying it instead of the owner employee, I don't know how that works in terms of what is legitimate. um,
I think in that I've been looking at that question for a long time. And
yeah.
just looking at it here, thinking about it. And I think we have to go back to day one. What type of business is it? Is it a sole proprietorship? Which means the business is me, and of course I can pay myself, a health insurance plan as a business expense. But what if it's a corporation? That's not me. I may have created a monster up here, but I am not the corporation. The corporation pays me, that might require something different. So every one of those business formats may very well change any answer that we give you. And I think in most cases, if people have, an incorporation, they have incorporated their business, that in fact, it's likely, if it's a successful business, that that corporation is going to pay for everybody's health care. That's what happens.
And then I don't know if there's a maximum number of employees um, for the for a small business to cover um, their employees. I don't know if there is like a limit. That's a good question, but I don't know that.
I'm going to get, you take a few questions. I'm going to get on my other computer to.
Yes, so there
Fine.
are a lot of great resources out there on the changes for the expansion program. So the rule that somebody mentioned about working out 80 hours is for those Medicaid expansion programs. And KFF is definitely a great resource. I've done a lot of research on there, and I believe that they are going to be writing a summary of the CMS, or they've written some stuff about what's in those CMS guidelines. So they do have some specific information. Thanks, Jennifer, for reminding me about the state Medicaid buy-in. So there's a lot of great information in there. So it is a great resource. So somebody mentioned it and reminded me that that is a good resource to go look.
Aleda,
Yes,
SHOP is for small businesses with 1 to 50 employees.
50. Okay, there you go. There's the 50. It's 50, the maximum.
Which sometimes
Okay.
Google works.
All right. I think that is all the questions we have now. So I think they're all answered. Yes, they are. All
Yeah,
right, so we have a minute to the hour. So
all right.
we'll give it a minute to see if we have any more questions. And if not, then we are giving you back 30 minutes of your day. If you thought it was 2 hours, and they're giving you more minutes to your day.
Yeah,
All
I
right.
did see a question fly by. Should people be registering for 1 hour or 1.5 hours CEUs? You were supposed to be here for an hour and a half. Yeah, and just like I tell everybody when they're registering their CEUs for Cornell purposes, if the session is booked for an hour and a half, you get an hour and a half. If that session is
There you
under,
go.
good for you. If the session is over, you still only get an hour and a half.
Okay. Ima, can you tell us what resource you're talking about that you wanted? I don't know if Social Security flags compassionate allowance cases. I think they should see that someone may qualify for compassionate allowance and be able to bypass the longer application process. So there was a question about that.
I think they are specially flagged as compassionate
Yeah.
allowances.
Yeah.
Terry cases or something, that really has a red flag on it, like do this now.
It's kff.org, which used to stand for Kaiser Family Foundation, but they've changed their name to just KFF. That's the resource we were talking about earlier. Sorry about that, Ima. I didn't make that clear. Hopefully you got that.
All right.
Well,
All right, everyone.
so I'm going to step in for Nikki. This is Cochelle. Just thank you, everybody. And just a reminder that our next time that we meet is next Tuesday, the 16th, and it is at 1 p.m. Eastern time. And we'll have more information at that point. Thank you for our presenters today and our ASL interpreters. Much appreciated. So I think we're good.